I'm one of the HIV docs at Merriam Hospital, and pleased to be one of the co-chairs of the AIDS Walk this year. I want to thank the organizers of the walk. Good shout out to APRI and ACOS, who are very close community partners and certainly essential collaborators in this fight against HIV. Also want to give a shout out to a couple other community partners, Rhode Island Public Health Institute, led by Dr. Amy Nunn, who's here today, Project Weber, who's somewhere in the back, and of course the Rhode Island Department of Health, who's led by Dr. Alexander Scott, and I'll mention her in a moment. Today I would like to say this: we are making progress, but we still have a ways to go. This past week I had a young gay man who came to see me about PrEP. PrEP is a drug pre-exposure prophylaxis. It's a pill once a day that can prevent HIV infection. This gentleman I saw hadn't had too many partners. He wasn't at extraordinary risk to get HIV, and I didn't think that much about it until his HIV test came back positive. About once a month I find that I'm giving a new HIV diagnosis, and it's really one of the least favorite parts of my job. And I really do look forward to the day when I never have to do that again. And in our fight against HIV and AIDS, I really believe there are three key things that we have to address. One, everyone needs to be tested of HIV regardless of any risk that they have, and more often if they're sexually active. These are guidelines that are endorsed by the CDC and all major medical organizations in the country. Two, we need to work harder addressing HIV among gay, bisexual, and other guys who are in sex with guys. This is the #1 population who's affected by HIV, and we, both in public health and the medical community, have to do more. We find that a lot of younger gay men are meeting partners online on websites like Grindr, Manhunt, Adam for Adam, Scruff, and Craigslist. This is backed up by data that we have in our state. It's not to say that we should be shutting down these sites or discouraging their uses, and I definitely don't believe we should be doing that, but we all need to be working together, both online and engaging some of these companies for HIV prevention. Finally, the third thing is that everyone needs to know about PrEP, especially people that are at higher risk. With these in mind, we really can end the epidemic.